Consider this. Every 7 minutes, someone dies from a drug overdose. That's 200 people every single day. This is not just a statistic, it's a call to action. Addiction is a complex issue that intertwines with the very fabric of our society, affecting individuals from all walks of life. It's not a sign of moral failure or lack of willpower. Instead, it's a chronic disease that alters the brain's structure and function, leading to compulsive substance use despite harmful consequences. In today's discussion, we aim to unravel the intricacies of addiction, challenge the stigmas that often surround it, and explore effective solutions that can bring about real change. It's an issue that demands our attention, our empathy, and our understanding. In the next few minutes, we will delve into understanding addiction, breaking the stigma, and finding effective solutions. Addiction isn't just about willpower. It's a complex interplay of psychological, neurological, and environmental factors. At its core, addiction is a chronic disease that affects the reward, motivation, and memory circuitry of the brain. It's not merely a moral failing or a matter of poor discipline, as some might believe. Addiction begins with the voluntary act of taking substances or engaging in certain behaviors. The pleasurable effects provide a powerful incentive to repeat these behaviors. However, over time, the ability to choose not to do so becomes compromised, leading to a compulsive engagement, despite harmful consequences. Neurologically speaking, addiction disrupts and alters the brain's normal functioning. Drugs, for example, flood the brain's reward system with dopamine, creating a euphoric effect. With repeated exposure, the brain adapts, producing less dopamine or reducing the number of receptors that can receive signals. As a result, the individual's ability to feel pleasure from anything other than the drug diminishes, driving them to keep using. Psychologically, addiction can be seen as a way to cope with uncomfortable feelings or situations. Individuals may turn to substances or behaviors as a form of self-medication, providing temporary relief from symptoms of stress, anxiety, or depression. Unfortunately, this relief is fleeting, and the underlying issues remain unaddressed, perpetuating a cycle of use and addiction. Beyond the individual, external factors also play a significant role. Genetic predisposition can make certain people more susceptible to addiction. Environmental influences, such as exposure to drug use, high-stress environments, or a lack of supportive relationships, can further contribute to the development of addiction. Clearly, addiction is more than just a bad habit. It's a serious health issue, steeped in misconceptions and stigmas. It's a complex web of interconnected factors, each contributing to the onset and progression of the disease. By understanding these complexities, we can begin to challenge the stigmas and stereotypes that often cloud our perception of addiction. Stigma can be a silent killer, making it harder for those struggling with addiction to seek help. Let's delve into the shadowy world of stigma. Stigma, a mark of disgrace associated with certain circumstances, qualities, or individuals, can be a formidable barrier to recovery for those grappling with addiction. It can manifest in many ways, from self-deprecating thoughts within a person struggling with addiction to judgmental attitudes in society. This can lead to isolation, shame, and a sense that one's struggles are a personal failing rather than a health issue. Indeed, stigma is not only damaging, but it's often based on misconceptions and stereotypes. To challenge these stereotypes, let's hear from those who've walked this rocky road. Picture Jane, a brilliant lawyer, a loving mother, yet caught in the throes of alcohol addiction. Or consider Tom, a respected professor, battling a hidden opioid addiction. These stories underscore that addiction doesn't discriminate. It can affect anyone, irrespective of their profession, social status, or background. Yet when we hear these stories, we realize that Jane is not just an alcoholic. Tom is not just an addict. They are individuals with dreams, aspirations, and lives outside their struggles. It's time we looked beyond the labels and saw the person behind the addiction. This perspective shift is the first step in dismantling the stigma. But how do we go about breaking this deeply entrenched stigma? The answer lies in empathy, compassion, and non-judgmental support. Empathy allows us to understand and share the feelings of others. It involves stepping into someone else's shoes and seeing the world from their perspective. By doing so, we acknowledge their pain, their struggle, and their humanity. We also need to replace judgment with compassion. We must remember that addiction is not a choice or a moral failing, but a complex interplay of genetic, environmental, and psychological factors. People with addiction are not bad or weak. They are simply people dealing with a health issue, much like someone with diabetes or heart disease. Non-judgmental support is another crucial aspect. This means offering help and support without passing judgment or making the person feel guilty or ashamed. It's about creating a safe space where individuals feel understood and accepted, making it easier for them to reach out for help. In a society where stigma often silences individuals battling addiction, we must raise our voices. We must challenge stereotypes, spread awareness, and foster an environment of understanding and support. It's not just about changing our attitudes, but also about influencing societal perceptions and policies around addiction. Remember, stigma thrives in silence and misunderstanding. By fostering open discussions, promoting empathy, and offering compassionate support, we can break down the walls of stigma. We can create a world where people are not defined by their struggles but by their strength and resilience. It's crucial to replace judgment with empathy, to see the person behind the addiction. Addiction is a treatable condition. There are numerous evidence-based approaches that have proven effective. Unveiling these solutions, we start with therapy. Cognitive behavioral therapy, for instance, helps individuals recognize and change thought patterns that lead to harmful behaviors. It's a journey of self-discovery where one learns to cope with stress and triggers in healthier ways. We also have medication-assisted treatment, a combination of medication and counseling. This approach helps to manage withdrawal symptoms and reduce cravings, providing a safer and more controlled pathway towards recovery. Medications such as methadone, buprenorphine, and naltrexone have been instrumental in treating opioid dependency. Another crucial element in the arsenal against addiction is support groups. Organizations like Alcoholics Anonymous and Narcotics Anonymous provide a community of peers who understand the struggles of recovery. These groups provide a platform for sharing experiences and strategies, fostering a sense of belonging, and reinforcing the commitment to sobriety. But treatment is just one part of the solution. We must also focus on prevention and education. By teaching young people about the risks and realities of substance use, we can help them make informed decisions. School-based prevention programs, public awareness campaigns, and parental guidance are all vital components of this strategy. Harm reduction strategies also play a significant role. These include needle exchange programs and supervised consumption sites, which aim to reduce the immediate health risks associated with substance use. Now let's not forget the success stories, the tales of triumph that remind us recovery is not only possible but also probable. Like the story of John, who overcame a decade-long struggle with alcohol. Through therapy, medication, and the steadfast support of his Alcoholics Anonymous group, he has now been sober for more than 5 years. Or Lisa, a former methamphetamine user who, with the aid of medication-assisted treatment and a solid support system, has reclaimed her life and is now a counselor helping others on their path to recovery. These stories and countless others challenge the notion that addiction is a life sentence. They underscore the reality that with the right help and support, recovery is within reach. They remind us that every individual has the potential to regain control of their lives and contribute positively to society. Indeed, recovery is possible, and every step taken towards it is a step towards a healthier society. Every victory, no matter how small, is a beacon of hope, illuminating the path for others and signaling that the struggle against addiction is one we can and will overcome. Today we've explored the complex world of addiction, challenged stigmas, and highlighted solutions. We've uncovered how addiction is a multifaceted issue, influenced by genetic, environmental, and psychological factors. We've emphasized the damaging impact of stigma and the power of empathy and understanding in combating it. We've discussed evidence-based treatments and prevention strategies and celebrated the resilience of those who've reclaimed their lives from addiction. Remember, recovery is possible, and every individual deserves compassion and support on their journey to healing. Together, we can break the stigma and find solutions.